Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about caring for your knee after having knee replacement surgery. So talking about long-term health, long-term care for your knee after surgery. So this is going to be prevalent for someone if you're only a few weeks or a few months out from surgery, or if you're someone who's a couple of years or even more longer out and further out from your knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our latest videos. So let's just go down the list. We'll talk about different ways to take care of your knee for long-term health, good longevity of your knee replacement. So one is muscle strength. Muscle strength is tremendously important, especially the muscles around the knee joint. So you want to think about your quadriceps, your thigh muscles, the muscles on the front of your thigh, thinking about your hamstring muscles on the back of your thigh, your calf muscles, your gastrocnemius, your soleus muscles, as well as strengthening your hips, so the muscles around your hip joints, your gluteus muscles, to maintain good stability, good alignment when you're moving and doing activities. This is important to help reduce stress and strain through the knee replacement and the knee joint itself, and just helps with overall physical capabilities and mobility, activity tolerance, things of that nature. So strengthening, especially the muscles of the legs around the knee joint. Focusing on low impact activities and exercises. So things such as walking, swimming, cycling, an elliptical machine. These are ways to maintain good body weight, maintain good cardiovascular health, while still at the same time not excessively putting stress and strain through your knee joint. On the same token, we want to try to avoid or limit very high impact activities. So this might be things like running, jumping, heavy weightlifting, cutting, twisting. Things like these are going to add stress and strain and lead to some premature wearing of the knee joint and possibly the need for revision down the line. So we want to focus on exercising and staying active, but focusing on more low impact activities and reducing and limiting those high impact activities that are going to put a lot of stress and strain through the replacement and the knee. We also want to focus on exercises for range of motion and flexibility. So no, you don't have to do those same, heel slides and quad sets that you did as you're rehabbing and recovering and going to physical therapy. But we want to incorporate some level of stretching, some level of range of motion, working on bending and straightening the knee a few times a week, and continue that consistently throughout the lifespan. So just maintaining good motion, good mobility of the joint. We also want to talk about weight management. So it's really important to maintain a healthy body weight. Just like doing these when you do high impact activities, having a excessive body weight is going to put increased stress and strain through your knee replacement. And it's also going to cause biological changes. So pro-inflammatory chemicals and messengers to be within the body when you have obesity and increased fat tissue. And that can also lead to breakdown of the knee replacement and the joints over time. So maintaining a healthy body weight. Part of that is exercising, like we've been talking about it. Another big part of that is nutrition. So there's a lot of key nutrients for joint health. Some of the key ones, the big ones, are calcium, vitamin D, and omega-3 fatty acids as well. Help decrease that inflammation throughout the body and throughout your joints. Some really good foods to incorporate are leafy greens, fatty fish such as salmon or sardines, nuts and seeds, and fortified foods to help promote healing and reduce inflammation throughout the body. Going along the same lines is hydration. Hydration is very important all the time for maintaining good joint lubrication, as well as just multiple benefits for overall well-being and health of your body. Some other things to think about is when we're exercising, when we're doing activities, we want to avoid overuse, we want to avoid overexertion. So, avoid excessive activity, excessive bending, excessive twisting, excessive weight and pressure through the knee joint. Not only is that going to increase your chances of breakdown of the knee joint over time, of the replacement, but also it can lead to some symptoms of pain, inflammation, swelling, and stiffness and discomfort. So we want to find that happy medium, and sometimes that takes a little guess and check, but avoid overexertion and just going all out every time we do an activity or an exercise. We want to think about footwear, so having good supportive shoes, sneakers with cushioning and stability can really go a long way, and especially if you have ill-fitting shoes, that can also, you can notice the negative benefits or the negative effects of that as well. So having shoes that fit well and are supportive and allow some good stability. We want to incorporate using an assistive device if appropriate. So that might be a cane, that might be a walker, that might be a knee brace. These are things that your physical therapist, your other healthcare professionals can help you, determine if these things are beneficial and appropriate for you. In some cases they are, and that's great. In some cases they aren't. People are able to function and are a little bit more mobile, and that's great as well. Some other things to think about is following up with your doctor somewhat routinely. It doesn't have to be the orthopedist unless there's a specific need or an issue, but you should be having regular visits with your family physician. Just talking about overall health and well-being, talking about if you experience any new symptoms or concerns, and they can refer you and direct you in the right direction if the need were to arise. You also want to be aware of warning signs of something that is wrong or something going on with the knee joint. There is still risk of complications, loosening, infection risk. So be aware of things such as new onset of severe pain, new onset of swelling, feeling of instability or buckling or giving out of the knee joint, or just changes in general to the knee and the knee's appearance. Being prompt to talk to your doctor and addressing these concerns can hopefully reduce the risk of needing more invasive revision surgery or other medical interventions. And just in general, we want to maintain a healthy lifestyle. So being physically active, again, maintaining good nutrition, eating well, managing stress, managing mental health. There's actually a lot of correlation between mental health and stress and anxiety and depression and pain and the levels and the extent of pain that people experience. There's a lot of psychological reasoning behind pain just besides the actual physical arthritis or whatever you might be dealing with. So maintaining mental health and stress management is very important. And just getting good sleep, getting good rest, and having a good support system are two other good tips for overall health and well-being, but also just for managing and maintaining life now with your new knee replacement. So I hope this helped provide you some useful tips, some useful insights to help manage and maintain good longevity of your knee replacement, maintain good health, mobility, and function. Please be sure to leave your questions and comments below, and thank you for watching.